communities that we should look up to them as they are at the forefront of methodologies. So I'm privileged to introduce Dr. Maya Jeyaraman, a senior systematic review. Sorry, I just want to pronounce your last name accurately. Jeyaraman. Yes. Okay, thank you. Senior Systematic Review Knowledge Synthesis platform here at the Center for Healthcare Innovation, an assistant professor in the Department of Community Health Sciences at the University of Manitoba. Maya recently received funding from Canadian Health Institute Research Strategy for Patient-Oriented Research, Primary Integrated Healthcare Innovation Network, and Manitoba Medical Service Foundation for the project titled Primary Care Interventions and Strategies to Mitigate Emergency Room Overcrowding, a Knowledge Synthesis. In this project, Maya engaged and collaborated with patient partners from across Canada in the research, design, and grant development, using funding provided by CHI's Prepping for Research by Engaging Patients and Public Partners Travel Work. After receiving funding, Maya continues to engage and collaborate with patient partners in conducting the review. So please welcome, and if you have any questions in between your talks, please don't hesitate to stop.
Thank you, Ugai, for your kind introduction. So as Ugai mentioned, I'm a senior systematic reviewer at the Jeyaraman Center for Health Innovation, and I'm also an assistant professor at the Community Health Sciences, University of Manitoba. So as Ugai mentioned, I'm going to be talking about patient and public engagement in a knowledge synthesis project that we recently conducted. The title of my presentation is Patient and Public Engagement in a Systematic Review and Case Study. I was told to include a conflicts of interest statement. The funding for our project was obtained from the following organizations: Canadian Institutes of Health Research, Manitoba Medical Services Foundation, and the Winnipeg Foundation. So, as we all know, traditionally, patients and public have contributed to research as a research participant, which includes a passive role of patient participants. But in the last several years, there's been a growing recognition on the importance of engaging patients, families, and caregivers in health research decision-making process. And as active research partners, where patient partners have taken up an active role in research. So, according to CIHR Strategy for Patient-Oriented Research, patient and public engagement in health research is defined as a meaningful and active collaboration with patients and public in governance, priority setting, conducting research, and knowledge translation. So many countries such as Canada, UK, and USA have actually strongly promoted patient and public engagement in their research projects. For example, in Canada, the Patient and Public Engagement Organization is Strategy for Patient-Oriented Research, similarly involved in the UK, as well as the PCORI, which is Patient-Centered Outcomes Research Institute in USA, have all strongly promoted and advocated patient and public engagement in the research process. So according to the Strategy for Patient-Oriented Research score, patient-oriented research refers to a continuum of research that engages patients as partners, focuses on patient-identified priorities, improves patient outcomes, is conducted by a multidisciplinary team in partnership with relevant stakeholders, and also aims to apply the knowledge generated to improve healthcare systems and practices. So before I move on to my project, I just wanted to give a brief introduction to systematic review because there are some in the audience who do not have a research background, and there are also some patient partners who might be attending the presentation. As we all know, approximately 2 million new scientific articles get published each year. So there might be 50 clinical trials that may get published on a specific drug, say, for example, drug A. And one clinical trial might say, yes, drug A is beneficial, and another clinical trial might say drug is harmful, and another might say it's we're not clear if it is harmful or beneficial. So as a clinician or a policymaker or a researcher, which one do we believe in? Is it really harmful? Is it really beneficial? So that's where systematic reviews come in. So systematic reviews, what they do is it systematically integrates existing research on a particular topic. It provides up-to-date evidence for policymaking and practice, and also it increases precision of estimates, resolves discrepancies in research, and also it informs stakeholders. So traditionally, systematic reviews have always informed stakeholders. So the triangle here represents the hierarchy of strength of evidence. As you can see, systematic reviews occupy the top of the pyramid, and systematic reviews provide the highest level of evidence to clinicians, policymakers, and other stakeholders. And so systematic reviews have a strong potential to have a great impact on patient care and patient outcomes. So as I mentioned earlier, traditionally systematic reviews have only informed patients, informed stakeholders. And patient and public engagement in systematic reviews has always been overlooked. So it is crucial to engage patient partners in a systematic review because it makes sure that the evidence synthesized by the systematic review is relevant and valuable to the public. So in this presentation, I will be reviewing our experience with patient and public engagement during a recent knowledge synthesis project on interventions to reduce overcrowding and wait times in emergency department. I will also be reviewing the factors that actually facilitated the patient and public engagement process during the design and conduct phases of our knowledge synthesis project. So the main objectives of our case study was to engage and collaborate with people with lived experiences from multiple provinces across Canada, from Manitoba, Quebec, and Alberta, as active research partners in order to learn about their direct experiences, hopes, needs, and concerns regarding overcrowding and wait times in the emergency department. To guide us in training and refining our review question and inclusion criteria, as well as the outcomes. To join us in the grant application process to obtain financial support from funding agencies, and to continue guiding us during the conduct phase of our knowledge synthesis project. So before I jump on to the specifics of how we engage patient partners or collaborated with patient partners in our project, I just wanted to give a brief big picture overview of our case study. So there were three phases: the design phase, the grant application phase, and the conduct phase. So during the design phase, after obtaining funding, we recruited and engaged patient partners to collaborate with us. And we had a group discussion to discuss and plan to finalize the systematic review protocol. Following that was the grant application phase, where again, patient partners supported our grant application in many ways. And following that, once we received funding, again, we recruited and engaged patient partners in different aspects of our knowledge synthesis project. So patient partners had a say both in during the design phase, grant application phase, as well as the conduct phase of our knowledge synthesis project. So there's different levels of patient engagement. As you can see from this diagram, there's 4 levels of patient engagement. The consultation level and the involvement, both of these levels are low levels of patient engagement where patient partners do not have as much power in the decision-making process as the researchers do. Whereas in the collaboration level, both researchers and patient partners have equal power in the decision-making process. Whereas in the highest level of engagement, where it is a patient and public-directed project, the patient partners actually have more power in the decision-making process compared to researchers. So in our project, we collaborated with our patient partners. So in our project, all the researchers, stakeholders, and the patient partners, all of them had equal power in the decision-making process. So in the next several slides, I will talk in detail about the methods that we used during the design phase, grant application phase, and conduct phase of our knowledge synthesis project, and how we engage patient partners in all of these aspects. So the first step was to actually get funding for our project, in the planning stage of our project, to be able to engage patient partners. So we had made an application to the CHI. Center for Healthcare Innovation offers funding award for patient and public engagement in research design and grant development phase. So it's called PrEP Award. So I had applied for that, and I was successful in getting a $2,000 funding for collaborating with patient partners during the design phase. So that allowed us to collaborate with patient partners. So once we obtained funding, the first point of contact was the spore support units. So I created posters and information sheets, and I sent them to the Manitoba Spore Support Unit, the Alberta Spore Support Unit, as well as the Quebec Spore Support Unit. So once I created posters, I sent it to them, and then the only eligibility criteria that I had for the research partners, patient partners, was that they should have at least visited the emergency department once in their lifetime for any reason. So once I sent the posters, the next step was that the spore support units helped in connecting me with all the patient partners. So most of the communication was through emails. So the patient public engagement experts in Manitoba at CHI communicated with the Patient Engagement Advisory Council members and also other local organizations. So the PPE platform in Alberta distributed emails through mailing lists to all the members, local community groups, and Indigenous organizations. So everybody, some of them called me directly, some of them emailed me expressing their interest to collaborate with us in our project. So once I made the initial contact, I spoke with them, and so in total, we ended up recruiting a diverse group of 12 patient partners who self-identified as Indigenous, immigrant, white, and or living with a disability. So once I recruited all the 12 interested patient partners with lived experience, the next step was to engage them. So I engaged all of them with lived experience as active research partners in my project. And we also used trained facilitators to build a safe environment to establish trust, commitment, and openness by facilitating a trauma-informed, anti-oppression, anti-racist, and anti-colonial approach to engagement. So I used different participatory approaches. I used a two-step modified Delphi process. The first step was individual face-to-face meetings, where it was a semi-structured interview with open-ended questions. I spoke individually with each of the patient partners, and then I collected the information. I took notes and I collected information and it was subject to thematic analysis. So once I also, during the individual meetings, I asked them feedback on what review outcomes are important to them, and I also gave a list of all the outcomes that the researchers thought were important, and I gave it to them and asked them for their feedback on what they think about those outcomes. After the individual face-to-face meetings, I organized a final discussion group, a group meeting, where patient partners and researchers were invited to attend a group meeting facilitated by the PPE experts who helped us in arriving at a consensus regarding the final review question, as well as the outcomes of interest. Also, simultaneously, researchers and other stakeholders in the project also provided feedback on the review question and the outcomes of interest as well. So in the engagement process, a meaningful compensation was provided to all our patient partners, including a $50 to $90 per hour honorarium and a dinner at the group meeting. The patient partners were very kind to attend the meetings in the middle of winter in -40. So I'm very thankful to all the patient partners who showed up to the meeting and supported us throughout the project. So during the individual meetings, patient partners discussed the barriers they had faced when they visited the ED and the potential facilitators that could mitigate the overcrowding and decrease the wait times in the ED. And also they provided their feedback on the outcomes and also provided feedback on the outcomes that was chosen by the researchers. And also, this helped in the identification of research priorities, research questions, the inclusion criteria, as well as the outcomes for the review. Also, in the group meeting, helped in refining the review question, resolving the conflicts between the outcomes identified by researchers and the patient partners. So initially, the review question had like a broader focus. Initially, we wanted to focus on interventions, but there could be hundreds of interventions in the context of ED to reduce overcrowding and wait times. So which one do we focus on? So based on our conversations with our patient partners and other stakeholders, we finally narrowed it down to primary care interventions and strategies to reduce ED overcrowding and wait times. And because they all felt that this would be a priority for patients visiting ED. So after all the facilitated conversations, consensus was also achieved on the outcomes because there were some discrepancies regarding some of the outcomes, and that was resolved. For example, patient partners thought that time to initial physician assessment was an important outcome that was actually missing in the list that we provided to them, and so that outcome was actually added as one of the review outcomes. So once we received all the feedback, we finalized the protocol, put together a grant application. So then we moved on to the grant phase. So two of the patient partners, out of the 12, two of them expressed interest in supporting our research grant application to the CIHR and provided letters of support of the application as knowledge users. And one of them supported our application as a principal knowledge user. So after the application process, we were successful in receiving both the local and the national grants for our project. So once we received funding, we had in the funding in the budget, we had requested funding for patient engagement during the conduct phase of our project. So once the funding arrived, then the next step was to start the actual knowledge synthesis project. So the first step to any systematic review is development of a search strategy that helps us to identify all the relevant citations based on the topic area. And this is usually done by contacting an information specialist or a librarian. So what's typically done is as a systematic reviewer, the first step is contact the information specialist. They provide us a preliminary midline search strategy, and I usually review it and review all the search terms. And then if I have any feedback, I provide feedback and then send it back to the information specialist. And then she finalizes the finalizes the search strategy, and then search strategy gets sent to another librarian for peer review. So that's the regular process. So what we did differently is the information specialist developed a search strategy, sent it to me, I reviewed it, I gave feedback, and then after I provided feedback, I sent it to our patient partners and asked them to provide feedback on the search terms. And I had to provide some training as to what the whole process means. So after the training part, each of the patient partner took a look at all the search terms and provided some valuable feedback. For example, trauma care was missing in the search term, and then indigenous healthcare was missing in the search term. So they suggested that we add those terms to the search strategy. There were also some redundant terms in the preliminary search strategy, and that was removed. So once that was done, I sent both my feedback as well as the patient partner feedback to our information specialist, and then she finalized the search strategy and then sent it for peer review process. So that was done differently. So after the search strategy was done, then as usual, we did the screening process. Two reviewers screened the title and abstract, and then screened the full text, and then finally decided on which studies are going to be included in our knowledge synthesis project. So at that point, I wanted to see if I can get any meaningful feedback from our patient partners. So what I did was I collated all the abstracts of all the included studies, and because it's impossible to expect patient partners to look at all the full text because there were hundreds of studies that were actually included in our knowledge synthesis project. So I sent it to them. So I offered them a chance to actually review all the included studies to see if they would have any suggestions or feedback. Also, I wanted to give them a chance to provide suggestions on any upgrade literature, any reports that they may know that's relevant to our project. So I offered them a chance for that. Also, finally, I organized, once all the data was in and we completed the analysis, we organized a meeting, a discussion group, where I invited not only the patient partners who were part of the conduct phase, but also invited everybody who was part of the process in the design phase. So all 13 people were invited back again to this meeting, and I shared the results of the project with them, and they provided some really meaningful feedback on the results, on how they interpreted the results, and I also got some really valuable feedback on what type of interventions that we should put. Because before I go into that, I want to say that ours was a knowledge synthesis project. First, we conducted a scoping review, and then it moved on to become a systematic review. So after the scoping review, we had this meeting. We discussed the results, and we asked them feedback on what type of primary care interventions we need to focus on, because the primary care interventions were divided into within ED and outside ED interventions. So they told us what would be really important to patients, and so we focused on those interventions for our systematic review. So they did provide very valuable feedback on our knowledge synthesis project results. So moving on to knowledge dissemination, currently we are in that process of engaging again patient partners in the knowledge dissemination process. So to summarize the findings of our case study, using a two-step process, we successfully refined our review question and identified patient-important outcomes. Patient and public engagement during the conduct phase helped in obtaining valuable feedback on the search strategy, identification of unpublished literature, in the interpretation of the results, and in the knowledge dissemination process. Patient partner involvement in the grant application stage was an important facilitator in obtaining funding for our knowledge synthesis project because they provided letters of support. And factors such as PPE funding by the Jeyaraman Center for Healthcare Innovation and involvement of PPE experts at the Jeyaraman Center for Healthcare Innovation and other support units were crucial and important facilitators of the patient and public engagement process during the design phase as well as the conduct phase of our knowledge synthesis project. So I would like to thank the Jeyaraman Center for Healthcare Innovation for their support throughout the duration of our project. I'd also like to thank our patient partners from Manitoba, Alberta, and Quebec for supporting us with our project and providing valuable feedback. I would also like to thank all the principal investigators, co-investigators, collaborators, principal knowledge users, and knowledge users from Manitoba, Alberta, and Quebec, who also supported us tremendously throughout the duration of this project. And a very special thanks to Ms. Carolyn Shimon and Ms. Bogay Zoe, who are the patient engagement professionals and experts at CHI, who helped us throughout the duration of this project with the patient engagement process and guided us throughout the duration of this project. So I also like to thank CIHR, Manitoba Medical Services Foundation, the Winnipeg Foundation for funding our project, the PICI Network, the Sport Support Units of Alberta and Quebec, the University of Manitoba, Alberta Health Services, and the Canadian Association of Emergency Physicians for supporting us with this project. Thank you.
So, did you take research ethics code approval for patient engagement?
That's a great question. At that point, because I received the prep award in 2017, and so I started the project in early 2000, around May, June 2018. I did contact the ethics board, and they said that I do not need to get ethics board approval for this project. So at that point, I did not, because I was told to. But then after that, I think in the end of 2018 or I think early 2019 is when CIHR came up with all the ethics approval process guidelines for the patient and public engagement. And I heard that things have changed from then to now. So you might still have to talk to the ethics board to see if actually you might have to get it done or not at this point. I think
Which
you
better
have
to
to
always check, because you always, because sometimes you think it's just a patient advisors you're meeting with, right? Patient advocates. But where do you draw a line when you're collecting the information?
That's right. Yeah, I would definitely contact the ethics board for sure.
It's good to connect with ethics board. It depends on the context, but if you're just engaging folks around the design of your research, most likely you don't need ethics. But it gets tricky because if you then start doing research on the engagement itself down the line, then you'll need ethics. So it's always safe to get ethics approval from the beginning to happen. Right, but to have the engagement piece on its own.
This is a question from someone viewing online. How did they decide on the compensation for patient partners? What expenses were reimbursed?
Well,
could you repeat the question? Just so that the online viewers know.
Yeah, so the question is, how did we decide on the compensation? So there was no guideline that we followed for compensation. I think I was told that the minimum compensation was the hourly per hour, $25 per hour. But then I really increased the honorarium because it was winter and it was pretty cold, and people, they really took interest in that, in appreciation of their time. I really increased the compensation because they're supporting us, and I wanted to support them. Yeah.
And I think just to add on that, you did talk to each of the individuals and ask how they wanted to be compensated, and some said they wanted to use gift cards.
Yeah, because I also spoke with each of them to see whether they preferred a gift card, or if they did prefer a gift card. There were several options available through EPIC at the university, Visa or MasterCard, or a Starbucks card, or Tim Hortons. So I did talk to them about how exactly they wanted to be compensated.
For patient partners from Alberta, did you have online conversations with them?
Yes, it was all online, because I didn't have enough funding to fly them over here to Manitoba, so it was everything.
Just a telehealth,
through telephone calls.
Phone calls.
You said you had 12 patient partners?
Yes.
So was it an even mix in terms of like gender and age, or did you notice that a certain gender and age were overrepresented in the 12?
That's a really great question. So there were, I would say, more women and less men in the group that I had. So yeah, in terms of age, I did not really ask for their age. Um,
So they just self-declared if they were over 18, obviously. Or
yes,
you
yes, yeah.
And you did have parents represented.
Yes, there were also two children because the poster that I showed was just one of the posters that I had.
Okay.
I also had children, but the parents of children were invited to join us in the discussion as well. So I did not restrict based on age. It's just that that poster said
18 and over, and you personally were a patient, so you did have representation of that it wasn't the actual patient, it was the parent of the patient.
Yes.
You had a couple of those.
Yes.
Okay.
Yes.
Was there a difference in their responses?
Not really. I guess not really. It's pretty much the same. The responses. I mean, obviously the responses would be different based on different questions that I was asking, and based on their own experiences, they were all different. What they were sharing was different, but they all came to a consensus and agreed on what they thought was important for the question, what they thought was important outcomes.
Could you explain how the recruitment process was done? I know you did the posters, but where were the posters displayed?
Well, actually, I was very lucky with my project because I did not have a very stringent eligibility criteria. All I was looking for is someone who has at least visited an emergency department once during their lifetime, and the odds of you coming across people is very large, right? So there were actually a lot of people interested in collaborating with us in our project, especially from Alberta. There were a lot of people contacting me, but I had to restrict to a certain number because I did not have funding beyond that. Sorry, again, your
but the posters displayed in the emergency department?
Yeah. So the thing is, like I created the poster and I sent it to the Manitoba's core support units.
Okay.
So they dealt with it in whichever way they wanted to. So what they basically did was they shared that with the advisory council at CHI and asked them if they asked the advisory council members if they would be interested in collaborating with me in my project. And a lot of people were actually really interested, so it was easy. The recruitment process was very easy for me, actually. And same with Alberta, they had this member list, so they did send like massive emails to all these people through the member networks. And then a lot of people either called me or contacted me through email, and then, so that's how. And then once they contacted, what I did was I had developed the information sheet about the project in layman terms, and with I provided them detail on what I'm intending to do, and also what they can expect from to contribute to this project, and also in terms of the compensation and what I was intending to compensate them for their time and appreciation for their time. So all those details were given in the information sheet. So they got the information sheet, and still they had a chance to review it and decide whether they still wanted to collaborate with me or not. So, yeah.
So if you have so many interested people, how did you pick the 12 that you did?
First come basis.
Okay.
Yeah, and also I was looking for a diverse group of people, so I also had that in my mind.
What are some of the results of the systematic review in terms of those interventions?
So the first part is completed, the scoping review, and the systematic review we're still in the process of analyzing. So I'm still not in a place where I can talk about it yet. But the manuscripts are in preparation and it will be out soon. So, but the scoping review had really interesting results. So we basically identified within a lot of primary care drugs. So in total, of, I think around 260 studies got included. And out of them, a majority of the studies were actually outside the primary care interventions and strategies. And also, and some of them, I think 1/3 of them were within the primary care interventions. So within that, there were several ways in which primary care was integrated as a part of the EP. So I can do another presentation about the scoping review results, but we had really good, interesting results.
So the follow-up question is, I was curious to know how you think the results might have been different if you had not had patient partners involved.
Well, first of all, because I engaged patient partners right from the beginning at the design phase, right? So they played a major role in deciding what kind of outcomes that I was including as a part of my systematic review, as well as the outcomes that we need to focus on for the scoping review itself. So that made a huge impact right there. And also the primary question, the review question itself, like, what type of intervention are we focusing on? Like, because there were so many interventions that could be, that have beneficial positive impact on the overcrowding or wait times, right? So, but the patient partners and other stakeholders felt that the primary care interventions, is something that we need to focus on. So that talking to patient partners helped us in focusing, narrowing down that focus to the primary care intervention. So that's where the major impact was.
So anyone of us is planning to engage patients and patients and other partners in our studies can conduct sport units?
You can, for sure, but because Jeyaraman has connections with folks from different provinces, always good to meet with us if you can, and then we can make them go. But always good to do cross-provincial work if we can, and they're there to support patient engagement as much as possible, because we see the value in that way. Does anyone online have any questions?
No. One.
Sorry, you have a question?
You have 13 partners for the design phase, and I think then 2 for the grant writing phase.
Actually, 3 for the two for the and 2 for the actually 3 for the conduct phase, but 2 of them were there throughout the duration of the project, but one of them had to step out because she was from Quebec. That's one of the challenges that we faced. The language barrier as well as the scientific barrier, I guess. Like when I sent all the abstracts of the included studies, the patient partner from Quebec said it's too scientific and also it's in English, and so she felt it's really hard for her to continue on. So she pulled out of
And then the 13 from down to 2 from design to grant writing phase, was that intentional too, or did people just drop off once you got to the grant writing phase?
Nobody dropped off except for the person that
Quebec. Yes. So you only wanted 2 then in the grant writing phase, or how did you decide?
It's not in the group, in the discussion group, in the group meeting that I had in the design phase. One of the last things I asked in the meeting was, who would be interested in collaborating with us and supporting us in our grant application. So please let us know if you are interested. And so only 2 people contacted me and wanted to support me in the application process.
Lots of folks don't know very much about research. Did you do any preliminary general training before you got started?
Like I mentioned, for the first step was the search strategy, right? In our systematic review, we started our systematic review project. So at that point, so what I did was I created a PowerPoint presentation, converted it into PDF later on before sending it to them. But so I wrote down everything in layman terms. I explained to them in layman terms what that project is. And then in the next slide, I explain to them what exactly is a search strategy means and why we are doing it. And so everything explained in layman terms. So it's a training as a part of the training. So they went through all of that and they were offered a chance to talk to me if they had any questions, clarify things. And then, so in the end, I did not actually provide them the actual search strategy because just looking at a search strategy would be very complex, right? So I extracted all the search terms individually and I made a list of all the search terms so it's easy for them to understand. So even in that, I said, if you have any question on each of those terms, just contact me. I can explain to you what are those search terms. And I think it was pretty straightforward. People could actually understand a lot of them. Yeah.
Did people have questions about why you have to do things in a particular way? Or like
there was one person from Alberta who had a question about because she didn't have a scientific background, so she had quite a few questions, and I explained to her clearly, what the whole process is, and she was okay with that, and then she gave feedback after that. But they did have questions.
Does anyone else have any more questions? If you have questions, let's say today as all this information you're processing or you want to do systematic review, please feel free to send your question to us and we can then forward it to Maya or can they directly email
Sure,
you if they have
definitely,
questions?
yes. Yeah, I'd be happy to.
Well, thank you all for coming. Our next lunchtime learning will be December, the second week of December. So hopefully to see you all then. Thank you.
Thank you.
thank you.